Hello, my name is Damali Scipio, a PMHMP student at ST University in classes NUR 620 Clinical Management. This is my ID. Okay. The patient that we saw this week was a 13-year-old Hispanic female with initials LA. She was initially referred by her school therapist due to exhibiting signs and symptoms of depression and anxiety. Now, subjectively, the patient initially denied feeling depressed, but admitted to experiencing anxiety for 5 years. On further inquiry, she admits to hopelessness, lack of energy and motivation, and sadness, which she currently rated at a 3 out of 10. The client states that these symptoms began at the time when her father and mother separated and he had left the home. She admits to a decreased appetite and losing more than 10 pounds in 1 year. Her mother, who was present during the interview, adds that the patient is seclusive, easily irritable, and has limited peer interaction as she refuses to go outside. In addition to this, her mother states that she has been placed in a special education beginning this year in 8th grade, although she has not been formally diagnosed with a learning disability. Okay, so the patient denies suicidal or homicidal ideation. She averages about 8 hours of sleep without restlessness. And this is her first encounter with a psychiatrist, and she has never been diagnosed with a psych disorder or has ever been admitted to an inpatient psych facility. Okay, she has no past medical history or history of suicidal attempts. However, she admits to a history of self-cutting beginning at age 12. She had done this twice a month, stating that she did it to feel pain, and her last episode was this year, January 2025. Now, when discussing her father, oh, sorry. When she's currently taking no prescription or over-the-counter meds because she has no past medical history. She denies any substance abuse, and she has no known history of family psych disorder. Okay. She is currently unemployed, living at home with her biological mother, and has not seen her father in some time. The patient denies all forms of abuse, but as previously stated, begins to cry when discussing her father leaving the home, which she perceives as traumatic. Let's catch up to there. Okay. All right. She objectively, the patient is well groomed. She's alert and oriented times three. She's calm, cooperative. Her mood is depressed, which is congruent with her affect, and her thought content is logical with a fair thought process, as well as her intelligence is fair. However, her clinical insight is poor, as she initially denies depression, but cries when discussing her father and admits to other depressive symptoms mentioned above. On assessment, her differential diagnosis would be social anxiety disorder and to rule out learning disability. The principal diagnoses would be major depressive disorder, classified as chronic, as it has been over 2 years, and general anxiety disorder. So now for the diagnostic screening purposes, we would use the PHQ-9, which she scored a 13, indicating moderate depression. For the GAD, we would use the GAD-7, which she scored a 7, indicating mild anxiety. So pharmacologic treatment was offered, but the client and the patient refused at this time, stating that they would like to opt to continue solely with therapy. Education was given regarding benefits of medication, especially if symptoms worsen, and as well as a crisis intervention suicide hotline. A referral was made to a psychologist for learning disability, just so that they could diagnose that if she does indeed have one. And then we made a follow-up for 1 month time. And then, although you can see the print and the signature here they are on the official hard copy of my pages, my original forms, all stamped. And that's the last page. The last page, as we did not diagnose meds, is just empty. Thank you.